page 69 I have explained you in my previous video. That is, I have explained like the lie of the, this is the uterus, this is the baby, the lie presentation, presenting part I have explained in my previous video. That is, lie means the long, like you draw the long, axis of the uterus and axis of the fetus. If both are parallel then longitudinal, if both are 90 degree then transversal. If it's making a divided for a little angle then it is a oblique lie. These are the lie and then presenting part and presentation part, cephalic presentation, base presentation. This will be at the internal loss. This I have explained. And presenting part, here the presenting part is a vertex. Here there are eyebrows, or here it's maybe chin. These are the presenting part. Here is a bow and this is a chin. This is a vertex, flexed vertex and vertex deflexed. This is a flex one, joint, and then this is flex one. This is not flex. This is a bow presenting part and these are the various cephalic presentation with different attitude. This I have explained in my previous video. In this video, I'll be explaining the page 70. Now coming for the presentation. Presentation: the part of the fetus which occupies the lower pole of the uterus. This is the uterus. Lower pole of the uterus is occupied by which part? In the pelvic vein. That is known as presentation of the fetus. Accordingly, the presentation may be cephalic presentation, where head is occupying the lower part of the uterus, or it may be phodalic, or it may be shoulder, or it may be 50, shoulder and other parts only 0.5%. Most of the cases you'll see the cephalic presentation. When more than one part of the fetus presents, then it is known as compound presentation. This is a simple presentation where the fetus, only one part of the fetus is presented. If it presents more than one part, then it is known as compound presentation. Now coming for presenting part. This is a presentation and complete part. The presenting part is the part of the presentation. That means also presenting part. The presenting part is defined as a part of the presentation which overlies the internal os. This is the uterus. Here you'll be having internal os, which coincides the at the position of the internal os. That will be the presenting part. Example you can see, and it is felt by examining the fingers into the cervical opening. Thus, in cephalic presentation, the presenting part may be vertex. It is the most common. I already said in 95% of the cases you see, like if 99.5% in the longitudinal lie, 96% will be cephalic presentation, of which vertex is the presenting part in 95% of cases. So most of the cases, vertex will be the presenting part. Then it may be bow presentation, or it may be entire face presentation, or depending upon the degree of flexion of the head. Here fully flexed, here not flexed, here extended, here fully extended. So depending upon the flexion and extension of the neck, you see the presenting part. Similarly, the fetal legs in breech presentation may be flexed completely in the complete breech, or extended, that is flank breech, or foot may be present. That is known as footling. Foot may be the presenting part. That is known as footling. This is in breech presentation. So, however, the term presentation and the presenting part are often used synonymously, expressed more commonly in clinical practices according to the later definition. So, there, even though we say separately presentation and presenting part, but they are used synonymously in the clinical in our practice. Now, coming for attitude. Attitude, the relation of the different parts of the fetus to one another is known as attitude of the fetus. The universal attitude is that of flexion. See, this is the attitude of the different attitude. This is a universal attitude. Everything is flexed. This is a universal attitude. That is like for one part of the fetus, we are comparing to the other part of the fetus. So, both are flexed like accordingly. This is a universal presentation. Fetus, everything is flexed. This is a universal presentation of the fetus. This is nothing but attitude of the fetus. See, this is known as attitude of the fetus. The universal attitude is a flexion. During the later months, the head, trunk, and limbs of the fetus may maintain the attitude of the flexion on all joints to form an ovoid mass corresponding approximately the shape of the uterus ovoid. See, it is forming the ovoid mass because near all joints it is flexed and forming the ovoid shape, which is corresponding to the uterus shape during the term. It forms all this. See, ovoid mass, which approximately the shape of the uterus is ovoid. The characteristic flexed attitude may be modified by amount of liquor amine. There may be expectations to this universal attitude and extension of head may occur. Deflex, vertex, bow, and face presentation according to the degree of extension. You can see the completely flexed, you will see the vertex as a presenting part. If not flexed, the deflexed head also see the vertex as, but if it is extended, you see the bow or face presentation. Depending upon the degree of flexion and extension, you see the presenting part may vary. And bow and becomes the extended part. In the course of labor, such circumstances may be modified accordingly. We can modify even. Denominator. The denominator means you have learned about the according to longitudinal axis, lie you have learned, then presentation, then presenting point, and then attitude. Now coming for denominator. We'll see what is denominator. Denominator. It is an attributary bony flexed point on the presenting part, which comes in relation with the various quadrants of the maternal pelvis. The following are the denominators of different presentation. Occipit, vertex, mentum, that is chin in the face, frontal eminence in the bony sacrum, in breech presentation, acromion process in the shoulder. The denominator is nothing but the bony prominence which come in contact with the internal os. Example, see, occipit. If it is a cephalic presentation and vertex, this in cephalic presentation, the head will be there, so the vertex may come in contact with the internal os, that bony prominent, or the chin, the vertex may come, or the chin may come as a presenting part, bony prominent, or frontal eminence. Frontal eminence it may come in like a breech presentation, and acromion. If shoulder is there, acromion process comes as a presenting part that we call as a bony prominence, we call as a denominator. And coming for a position. Position, it is a relationship of the denominator to different quadrants of the pelvis. We have to first divide the pelvis into different quadrants, then which comes in the presenting part. That too, like in bony flexed point, the attribute for the bony flexed point, that becomes a denominator. Okay. Position, it is the relationship of the denominator with the different quadrants. Denominator may be vertex, maybe chin, or maybe frontal eminence, or maybe acromion process. This with relation to the quadrants of the pelvis we call as position. For descriptive purpose, the pelvis is divided into equal segments, the 45 degree. So these are 90 degree. We are dividing 90 degree into two halves: 45 degree, 45 degree, 45 degree, 45 degree, and 45, 45, 45. So you get totally 8 quadrants. See, 1, 2, 3, 4, 5, 6, 7, 8. 8 quadrants. For each 45 degree, we have divided into one quadrant. So this is a position. We'll read for position again. It is the relation of the denominator, that is presenting part, vertex, chin, frontal eminence, or sacrum, or acromion process with different quadrants of the pelvis. That too, we are dividing at 45 degree for each quadrant. So you're getting 8 quadrants to place the denominator in each segment. Theoretically, there are 8 positions in each presenting part. 8 positions for each presenting part. These are presenting part for everything. We'll be having 8 quadrants. You see, if this is a presenting part, cephalic, this is a presenting part. You have 8 positions. positions 1, 2, 3, 4, 5, 6, 7, 8. 8 thing. See, I'll explain this in detail. Anterior, posterior, right and left position is referred to in relation with the maternal pelvis. Like according to with respect to the maternal pelvis, whether it's present anterior, whether it's present posterior, whether it's present right or left. However, some may have retained conventionally for the descriptive only 4 vertical position. Only these 4. Vertex occupies the left anterior quadrant. This is the left anterior quadrant. Left anterior, this is left posterior, right posterior, right anterior, and right transverse, left transverse, and this is a anterior and this is a posterior. So this O represent occipito. This is because occipit is a presenting part. So the position may be out of 8 quadrants: occipito anterior, occipito posterior, right occipito anterior, right occipito transverse, and left occipito anterior and posterior and transverse. These are the 8 quadrants of which we divide the maternal pelvis. I'll read this once out. The position and relative frequency of this onset of during the onset of labor. Chances of being in a right occipito anterior is 10%, transverse is 24%, is the most common, and this 1%, 7%, 3%, all this. See, however, some may have retained the conventional description only 4 vertex point. Vertex occupies the left anterior quadrant of the pelvis is the most common one. Left anterior quadrant, this is the most common one. Or left occipito anterior, we represent as LOA, left occipito anterior. The first vertex position. Similarly, the right occipito anterior is there, and all this I'll be saying remaining part in my next video, the next page in my next video. If you find this video helpful, please do like, share, subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.